1. While acquiring information about the current medication use of the client tells the nurse that they take the herbal supplement ginkgo to improve mental alertness. The nurse should inform the client to A. Avoid any exposure to the sun whilst using ginkgo. B. Buy only brands with FDA approval. C. Increase daily intake of vitamin E. D. Report signs of bleeding or bruising to the doctor. Answer D is correct. Ginkgo interacts with many different medications to increase the risk of bleeding. Because of this, bruising or bleeding should be reported to the doctor. Answer A is incorrect because photosensitivity is not a side effect of ginkgo. The FDA does not regulate herbals and natural products, and therefore answer B is also incorrect. Lastly, the client does not need to take additional vitamin E, therefore answer C is also incorrect. 2. The client has a prescription for a calcium carbonate compound in order to neutralize stomach acid. The nurse should assess the client for A. Diarrhea, B. Constipation, C. Hyperphosphatemia, D. Hypomagnesemia. Answer B is correct. A client using calcium preparations will frequently develop constipation. Answers B, C, and D do not apply in this scenario. 3. Which of the following medications are Category X medications and therefore should not be taken by the client during pregnancy? A. Sulfasalin, B. Devonex, C. Levothyroxine, D. Minocycline, E. Tazorac. Answers B, D, and E are correct. Devonex, minocycline, and Tazorac are all medications under Category X and should therefore not be given during pregnancy because they are teratogenic. 4. Your client is taking alendronate sodium, Fosamax. Which instruction should you give to your client? A. Remain in an upright position for 30 minutes after taking this medication. B. Take the medication while lying down. C. Force fluids while taking this medication. D. Take the medication together with estrogen. Answer A is correct. This drug causes gastric reflux, so the client should remain upright and take it with only water. Alendronate sodium is a drug used in the treatment of osteoporosis. Alendronate sodium should not be taken while lying down and should not be taken in conjunction with another medication or with estrogen. Notice, there is a clue in the name of the drug, fossa as in fossils. All the drugs in this category contain the syllable dronate. 5. A client is discharged with a prescription for Evista, raloxifene HCl. The nurse should inform the client that which of the following is a side effect of this drug? A. Urinary frequency, B. Leg cramps, C. Hot flashes, D. Cold extremities. Answer C is correct. Evista is a drug used in the treatment of osteoporosis. The medication has an agonist effect, which binds with estrogen and which can cause hot flashes. The medication does not cause any of the other symptoms, and answers A, B, and D are therefore incorrect. Notice, the E in Evista stands for estrogen. This medication is in the same category as the chemotherapeutic agent tamoxifen, Nolvadex, which is used for breast cancer. 6. The client, an elderly diabetic, is scheduled for a cardiac catheterization. The client has been taking metformin, glucophage. The nurse should instruct the client to A. Take the medication with only water prior to the exam. B. Take the medication as usual prior to the exam. C. Limit protein intake prior to the exam. D. Discontinue the medication prior to the exam. Answer D is correct. This is because glucophage can cause renal problems.